Welcome Ian to Kirkley's Public Eye, and I just wanted to catch up on how are things in Jamaica?
Yeah, things are getting a little more gloomy each day. We thought we were about to flatten the curve about a week ago, and then all of a sudden there was an upsurge. We're in one of the BPO, the call centers. It was discovered that there was a cell of infections there. A cell. I mean, it's like almost like a new center. Mm-hmm. It's like a center within the country where there was a virus. There was an upsurge in the number of victims, and on an average over the last few days, we've been having 20 odd a day, and it looks now as if we have reached a stage where the community infection is beginning to take place, and that's why it's frightening. And that has now forced the government to take fairly stringent measures. They've closed down all the call centers, which is a major move because there are close to 70 of them spread throughout the country, employing something like 40,000 people, mostly young people between the ages of 18 and 32, and which brings in income of about $4 million a week. So you can see the massive effect that closing down these call centers is going to have on an already threatened economy from the literal closing down of the tourist industry. So things are not looking very pretty for Jamaica right now.
Is that the same case across the Caribbean?
Don't think so. I mean, as far as the countries that are tourism dependent, obviously they are going to suffer the economic shocks. And Trinidad, which took early action, seemed to have taken control of the situation, although they're still in lockdown. Barbados, for a while, seemed to, have been going awry, but in recent days, there seemed to have been a slowing down. And the same pattern is emerging right throughout the rest of the smaller countries of the Caribbean. The big exception, of course, is the Dominican Republic, which now has, quite a substantial number of corona victims, both in terms of infections and in terms of actual death. So, yes, Jamaica, which in the early days seemed to have been one of those that had it under control, thing has been knocked out of kilter now by this by this cell. I mean, it's almost like a cell, and it's focused in the parish of St. Catherine, in the dormitory community of Portmore, which houses now, 500,000 people. So you can see how frightening the situation is in potential.
And what kind of aids are you getting in there? Are you getting the proper protection? Do you think the government were proactive with this, or do you think that they were slow to move?
No, I think the government overall was proactive. I think the tactical error that this government made was not to have included a wide array of elements and skills. It was slow to involve the communities and slow to involve the opposition party. And we saw an example of that last weekend when it had a shutdown of the Portmore community and caused near riots with people not being able to get money from the banks or the ATMs, not being able to go to the supermarket, not being able to buy food, and all the efforts about social distancing and wearing masks were totally ineffective because people were just desperate. And that had to do with not bringing into the discussions and the collaboration of people within the community. But otherwise, I think the country feels generally that the government has acted fairly decisively. And in fact, there are elements that has asked me to do more. I mean, there are calls for the locking down of the country, but somehow I don't think that's going to happen.
You mentioned earlier on that they're taking more stringent measures. Yeah. What do they look like?
What they've done is to extend the curfew hours. So, for instance, there's an island-wide curfew now between 6 p.m. and 6 a.m. It says businesses must close by 4 o'clock throughout, and it now has made it mandatory for everyone to wear masks in public places. So those are right now the immediate, and of course there is the constant drumming in of the business of washing your hands and wearing masks on public television, on the radio, in the newspapers, and so on. So I think the country generally is aware. In fact, there's an interesting anecdote of one small community which is doing its own policing. So it has three entrances and exits to the community. And what they have done is to set up stations at each of these entries with hand sanitizing equipment, with masks, with temperature guns, and anybody who comes there. If you're a member of the community, you're sanitized and your temperature is taken. If you're not a member of the community, you have to say why you're coming there, and they may or may not let you in. In other words, we have a community which has taken total responsibility for protecting itself and its residents.
And how is that seen with the local government and obviously the government of Jamaica?
Oh, well, we haven't had an official response, but I can't see how. I mean, you know, it was on public television last night, it's on social media, and the response from the public, of course, is very supportive. Yeah. But of course, any kind of action that protects the community is going to be welcomed.
Has got to
in fact, what they're doing is now saying, and they're saying that they've done it at their own expense. Yeah. And they're now asking the government to support them in their efforts.
Well, I can tell you now, there's no law for us to wear masks in public spaces. We know that's in China, and that is in Jamaica. I'm just staggered by one virus, and yet all the different countries have taken a different strategy. Some were proactive, some weren't, some you have to wear masks, some you don't have to, but it's the same virus. Yeah?
Yes, exactly. Yeah.
I think
it has to do with the culture of each country.
Okay.
And in Jamaica now, as I suspect other places, the whole, there an entrepreneurial element has crept in. All sorts of people are making masks now. And there's also a fashion element that has crept in. So you go into, say, a pharmacy or a supermarket, and the array of masks you see nowadays, compared to what you saw, say, a month ago, is quite dramatic and interesting.
Mm-hmm. So how is your services done in terms of medical care and health care? How have they done?
I think they've held up pretty well. Huh? Obviously, in like all countries in the early days, there was a shortage of especially ventilators. And what has happened now is between the European Union, which a week ago donated close to 30 ventilators, and local business organization, which has pooled together, collected money, and have gifted the government with ventilators. I mean, so that's been one of the major things. And in fact, in many respects, we are much better off than places like New York.
Yeah.
In the sense that there seems to be no crisis at the moment. So yes, Milton, the big problem that we're having in Jamaica now in terms of the health services is the whole business of discrimination. Because the society now, on one level, is discriminating against people and relatives of people who have been identified as being victims of this the infection. That's on one level. But frontline healthcare workers, unfortunately, are suffering from that. So even within hospitals, nurses and other healthcare workers are complaining that the ones that work in the accident and emergency units, that's the unit that deals with corona patients who come in, and nurses and medical personnel who work in the isolation wards or in the ICUs are being discriminated against by their colleagues, which is very sad.
I haven't heard the word discriminate, but implicitly, that's what's going around in England right now, that frontline workers, and especially those in healthcare, are not getting the kind of supplies that the NHS are getting. So it's very, very difficult. And healthcare workers are catching hell in adult healthcare, home elderly and places like that, because they just don't have the resources.